A stroke can happen to anyone at any time. It doesn't matter how old they are, their sex or their race, their ethnicity. And with May being National Stroke Awareness Month, we want to make sure you know what to look for, how to prevent a stroke, and how to tell if one is happening to you or someone you love. Dr. John Tanner, a neurologist with Loveless Medical Group, is here with us this morning. Good morning, Dr. Tanner. It's good to see you.
Thanks for having me.
Okay, first thing, stroke. For folks who don't know, what is it?
Well, a stroke is basically if you think of a stroke as a brain attack, much like we think of a heart attack, it's an attack of the brain caused by a blocked artery. So a blocked artery will cause no blood flow to a part of the brain and cause symptoms.
Okay.
It's important to recognize signs and symptoms of a stroke.
Absolutely. Okay, so what do we need to look out for that if we might be having one ourselves or someone we're around might be having a stroke? How can we tell?
Okay, there's a mnemonic called FAST. And FAST stands for face, arm, speech, and time. And what you do if your family member is having something you think is a stroke, ask them to smile at you. If there's an asymmetry of the face or there's droop on one side, that's a symptom. Ask them to raise their arm, and if there's drift or they cannot raise one arm, that's a symptom.
Okay.
Ask them to talk to you, speak to you. If they have slurred speech or have difficulty repeating something or don't make any sense, that's a symptom.
Okay.
And then time is of the essence. We need to identify that symptom, call 911 immediately, get them to the hospital as fast as you possibly can for treatment.
Okay, I imagine it's like a heart attack or a lot of other things,
Yes.
where the faster you call 911 and the faster you get EMTs and paramedics or someone to a hospital, the more likely they are to survive this.
Exactly, Matt. Treatment in the ER, basically, at, say, Loveless downtown, if a patient comes into the hospital within a 3-hour window of the onset of symptoms and the treatment, we can treat them with TPA. And TPA is a drug that dissolves a fresh clot in the brain and allows blood to return to the brain to regain function.
Okay.
Okay. We admit the patient, then we treat him with drugs to look at risk factors, hypertension, diabetes, cholesterol, smoking, address those, treat those, and then we move them to rehab.
Okay.
And do at Loveless Rehab, part of the hospital.
So what goes on there? What's the rehab like? What's the lingering effect of having a stroke?
Okay. Our goal in rehab is to increase the ability of neuroplasticity to regain function. So physical therapy, occupational therapy, speech therapy, neuropsychology functions and assessment and therapy increase neuroplasticity and increase the regaining of function. And this function increase will increase your ability to have your independence when you are recovering or have recovered from that stroke.
Okay, so before you get to that point of having a stroke, are there things we can do to try to prevent this from happening to us?
Yes.
Is it a diet, exercise kind of thing? What is it?
Well, a stroke is a vascular disease, and vascular disease, like heart disease, is caused by the diseases that are so common. Diabetes, hypertension, cholesterol that's elevated, and smoking. Smoking actually doubles the risk of stroke compared to non-smokers.
That's probably the easiest one to
And
fix.
It's the
Just
easiest
stop
one.
it.
Just stop. It's
Yeah.
the best thing they can do for their health. Is
Okay.
to stop smoking.
And the other things you mentioned, it just sounds like being healthy overall, eating a balanced diet, getting a little bit of exercise.
Yeah, exercise. A sedentary lifestyle and obesity is a risk. And then drinking alcohol can be a risk as well.
Okay, just real quick on that. I hear the thing all the time about red wine. Good, bad, moderation?
Oh, moderation's fine. I think 1 glass, 2 glasses a day would be fine.
Does it actually help, or is it just okay?
Well, there's some evidence that it shows that it does help a little bit.
Okay.
But, we try not to recommend drinking a whole bottle every night.
Absolutely. What about the aspirin idea, too?
Okay, aspirin it actually reduces stroke risk by about 20 to 30% compared to non-aspirin takers in the population that have those risk factors, so hypertension, cholesterol, diabetes. If you don't have those risk factors and never have had a TIA or stroke, then aspirin may introduce a risk of bleeding instead of a protection. So it's only useful for the patients that have those risk factors to take.
It sounds like it's one of those things you want to talk with your doctor about first before you start taking one daily.
Absolutely.
Okay, Dr. John Tanner, great information. Thanks for coming in. You speak very well on it. By the way, you want to find out more about Dr. Tanner and Loveless, go to casa.com, click on the blog. We'll be right back.